All right, Dr. K, Dr. Kevin Kavanagh is a retired physician. He also started an organization called Health Watch USA. We do this periodically, Kevin. Tell us what Health Watch USA is about and why you started it.
Well, Health Watch USA is a nonprofit organization primarily to promote patient safety and also looking at research integrity to try to look at infectious disease research and make sure that the conclusions represent what we should be doing in the strategies to prevent infectious disease. So we've been very active, and this year we have a conference that we're quite excited about. You can see this at healthconference.org. It's an international conference, and we actually have the Deputy Secretary of the Veterans Administration, Carolyn Clancy, that will be participating and opening the end part of the conference, where we'll learn about the VA system and what they're doing to prevent COVID-19 at the VA. So we're quite excited about that.
Guess we need to start off with the children appear to be sort of the driver of the spread of variants in the Midwest and Northeast. Who knew?
Well, yes, and that was kind of observed up in England, the United Kingdom, during their initial outbreak with the UK variant. Of course, they had just opened up schools. Children were then driving the pandemic up there, and this is something that we had been warning about, that although children may not get severely sick, hospitalized, or succumb to the disease, they can still spread it, especially the teenagers, those above the age of 10. And this is something that is of concern. And that's one of the reasons why we have been hammering home since last August that schools, they really do need to pay attention to spread. Let's get better ventilation in the schools, get air sanitization. You need to be careful about aerosolization of the virus, which can occur with loud speaking, and why we've been pushing for N95 masks, to use those whenever possible. The CDC has come out with some guidance for cleaning the air and for aerosolization, but really hasn't made, I think, strong enough requirements to get these buildings open safely. So we need to do this. We need to get our children back in school, but we also need to do it safely. And of course, remember that when we talk about severe illness, we're really talking about being on a ventilator, ICU, and there's death. But with COVID-19 and long hauler syndrome, that's not necessarily the bar we need to set our sights on. We need to really snuff out this virus and its spread. And so follow public health advice and get vaccinated.
Since we've got 5 months or 6 months under our belt as far as vaccine safety and efficacy data, and vaccines remain really highly effective. Pfizer Vaccine, what are they talking about now? Possibly giving it to children 12 to 15?
Yes, they are. They're releasing results on that. It's been excellent, the results. They tested 2,260 participants in the trial. In the placebo group, that's the group that didn't get the real vaccine, they had 18 cases of COVID, none, zero in the experimental group. So they're saying that this is 100% effective. Of course, that's in a small group of people. Nothing in medicine's 100% effective, but it appears to work really well. And remember, that group of students has been known for a long time to really be able to spread the virus, even though they don't have as great a chance of getting severely sick or succumbing to the disease. So this is good news. The younger kids, they're still studying. Younger children, very young, of course, they're worried about that multi-system inflammatory disease. That can be long-term, very severe, but very rare, and it may take them longer to get clearance for that age group. And as you said, the data out now shows that this vaccine gives immunity for at least 6 months. Probably longer, they just haven't studied it. That's why they say 6 months. They haven't studied it longer than that. And they state it's highly effective, which is good because that means, to me, it's got some life in it to go well beyond 6 months. So that's very good news. Again, get vaccinated. And when you get 6 months of efficacy data, remember, they also have 6 months of safety data. So the data they have coming in now would be equal to a clinical trial if it was actually run in a standard fashion. They have 6 months of solid data. Things are looking very good.
And here's a text on our Auto Tech Service text line. I think in response to what you just said, is the vaccine only good for 6 months?
No, absolutely not. And we kind of went over that on Monday too. When they release all these advisements and announcements, that's just because they've studied it for 6 months. So they say it works for 6 months. But the same is true for long hauler syndrome. When they say we have patients that have these diseases and symptoms at 6 months, well, that means they've studied it for 6 months. They don't know what happens after that.
Good enough. Let's go back to the phone calls. John, good morning, John. Thanks for holding.
Good morning. Thank you for taking my call.
Sure.
Dr. Kavanagh, I had a couple of questions for you. The first one is, if you are able to get N95 mask, is there a way to clean those so that you can reuse them? And what would that, that life of that N95 be if you cleaned it?
Well, it depends upon the type of mask that you have. Now, I'll be honest with you, I reuse my N95s and I do buy those online. You can find them from a variety of places. You can search Amazon, Google it. And what I do is I have several of them and I leave a used one out for 5 days. And that's providing it, isn't dirty. In other words, it hasn't been sprayed with moisture, something like that. And hopefully after 5 days in room temperature now, not in a freezer, but hopefully after 5 days in room temperature, it should be pretty clean. That's just what I do. There's no scientific evidence to base that on. But if I go out and I use an N95 mask for 10 minutes in one day and have some exposure, I don't want to throw it away. There's not that many around. So that's what I do. Cloth masks, of course, are completely disposable. Some of them you can actually wash them, but they do not give as good a protection. You have to be very careful with those. You want to have multiple layers. And of course, they need to fit tightly around your face. If you're breathing out the sides or you're fogging your glasses with an aerosolized virus, it won't give you good protection.
And the second question I had was, I know that you wipe your groceries down, and we have been doing the same thing. My question was, since the evidence has come out that the virus doesn't spread quite as much by surface contact, are you still wiping down like your canned goods, box goods, pallet plastics, anything that's kind of on the shelf?
Well, I don't wipe down boxes. I throw those away, then wash my hands afterwards. Actual food or anything that goes in the freezer, I tend to wipe down. If it's canned goods, I tend to just put those in the back of the cabinet. And, after 3-4 days, they should be pretty good to go. And of course, you always have to be careful. So you want to do that type of wiping down of groceries anyways. And that's the big thing to stress. I mean, you've got salmonella, you've got E. coli. You really do need to wash your fruits and vegetables. You want to handle meat carefully. Be sure that you clean your hands before and afterwards. Don't want to put it on the countertop. If you do, you've got to clean the countertop. So some of that we need to be doing anyways.
Dr. Kevin Kavanagh is our guest this morning. Also, Lane Haslock, our producer, is in the studio with us. And Lane, I think you had a question for Dr. K.
Yes, Dr. K, they're making these personal air purifiers smaller and quieter. Could they be used like on a student's desk or in a lecture hall or maybe in your cubicle at work? Would they be effective against COVID?
Well, I can't tell you that. It depends upon how much air that they circulate. You do want to have good air circulation, and you really do need to pay attention to air sterilization. So it depends upon how well they purify air and how much air they circulate. So you'd really have to see the specs of the purifier, plus also the size of the room. Certainly, it would be better than nothing, but whether or not it's really going to move that needle, I just don't know. And I should add that when I was talking about groceries and items in the environment, that you really do need to wash your hands after handling those. That is key, because with the new variants, they're more infectious and we really don't know what makes them more infectious. So they may spread more in the air, they may survive longer in the environment, but let's be as careful as we can with a new wave approaching.
All right, here's from Bill. This is an auto text service, text line text. Are vaccinations waning because it's down to middle and younger age group, or because who is going to get vaccine has pretty much gotten it?
No, I think it's waning because we're getting into a group of people who are vaccine hesitant. And unfortunately, it has to be some people who believe that vaccines don't work, the pandemic isn't a problem, the virus isn't more dangerous than the flu, all of which is certainly doesn't make much sense. It's not true. And the flu, by the way, is a very dangerous virus. So I think we're getting into that sort of a situation, and a lot of the younger people thinking that they're immune, they won't get very sick from this virus. Well, that's not the case. You can get very sick and even long hauler syndrome if you're very young. And some of these cases have been reported in up to 20% of people who are mildly infected. So get vaccinated. This is a dangerous virus.
What about this mutation in India? What can you tell us?
Well, that's probably the most disturbing mutation that we've seen so far. That mutation or variant has 2 escape mutations on it, and that's what makes it so disturbing. It has the escape mutation, which is found in the California variant, and it has a very similar escape mutation, which is found on the New York or the South African variant. And if anybody gets confused by the letters and numbers of all these mutations, the letters represent an abbreviation for an amino acid. The number is the position. So the first letter is the original amino acid, then the position of the mutation, and then the new amino acid. And the only difference in the Indian variant from the South African or New York variant is the substitution of the amino acid. The position is the same. And so I think that's very concerning because it may actually escape immunity more than what you're seeing in the Brazilian and South African variants. And hopefully, after saying all that, I've got all my variants correct. Believe me, it's hard to keep them straight.
Yeah, no kidding. No kidding. Wally on our Auto Check Service text line wants to know, is it proven that the vaccine will not genetically affect cells/human genome?
As much as you can prove anything. The vaccine, first of all, they are mRNA-based types of vaccines, the Pfizer and Moderna. The Johnson & Johnson, although it's a DNA vaccine, the DNA, what it does is make mRNA. It just is in the outside of the cell. It does not go into the nucleus of the cell where the genetics of the cell is. And plus, it does all this work in your arm. It doesn't go throughout your body. So all of that is just scare tactics by what I think are really foreign actors trying to discourage us from getting a vaccine and combating this virus. And one of the things you really need to start to look at is the State Department reports and everything that has to do with China, where this came from, the Wuhan lab, and it's looking more and more likely that this virus may have some origins in that setting. And for all of those who are conspiracy theorists that think that this is some sort of bioweapon that was released, if you think that, and I don't think that's correct, but if you do think that, it doesn't make any sense then not to get the vaccine or this virus isn't very, very deadly and very serious. Those two things don't even make any sense together. So let's get a vaccine and let's go out and follow proper public health advice.
Dr. Kevin Kavanagh, always a pleasure. We'll talk to you on Monday. Have a good weekend. Happy Easter.
Thank you, Jack.